Welcome. I have the pleasure of interviewing Dr. Shehab Faragallah. He was a dentist with over 20 years' experience working on the Gold Coast in Australia. He has been working the Gold Coast holistic dental care since 2017. Shehab has a special interest in oral myology and early interceptor treatment to correct orofacial muscular dysfunction. He also specializes in tongue and lip tie release, where he treats patients of all ages. Shehab is the co-inventor of the Myospot tongue elevation trainers, which is one of the reasons I'm interviewing him today. Shehab, welcome. Thank you very much for joining me on my channel.
Thank you.
I would be interested really, what got you going in this area? Your early experience with myofunctional therapy, what interested you in this area?
Okay, Mike, look, as a dentist, when I first graduated, I was doing the average dentistry, and it got to a point where I wasn't enjoying myself too much. And eventually I started to experience things in holistic dentistry. One of my first experiences was I had a patient come in, and I know this is a little bit unrelated, but I'll quickly recount this story because that's what opened my mind to holistic dentistry, especially, and it was the pathway into myofunctional therapy. I had a patient who had a sore tooth, and he asked me to take his tooth out. There wasn't too much going on with that tooth, but it bothered him. And there was a bit of to and fro, and eventually he convinced me to take out his lower molar tooth. I gave him options to repair it, but he wouldn't have any of it. And then after I took the tooth out, I didn't see him for a couple of months. And a couple of months later, he says, "Shehab, you wouldn't believe it. After you took out that tooth, I had a lymphatic swelling that was in my groin for over 15 years. And I've had it tested multiple times to see what it was. And doctors couldn't give me an answer. And after you took out that tooth, that lymphatic drainage in my groin area completely went away." And I realized that the body's so interconnected afterwards. It was something that I thought to myself, well, there's something more to teeth than just what's in the mouth. And
yes, there's more than we understand going on.
Absolutely. Yeah, absolutely. And then I had multiple experiences after that, and I learned a little bit about the effects of mouth breathing and how that connects to facial development, and also, just mind development in children. And I remember going to a talk, and I know you know Dr. Flutter as well, and he was one of the guys that I actually spent some time with. And I remember coming home after learning some of this information and looking at my children. One of my boys had his mouth wide open when he was asleep, and he was about, at that age, about 3 years old. And I thought it was cute. But then I realized that this boy is struggling for air, and he can't breathe through his nose. And so with time, I decided to take the step to do something about his inflamed tonsils and adenoids, and he ended up developing really well afterwards. So it all became interconnected. The mouth sort of being open meant the tongue wasn't elevated to where it should be. It meant that he was starting to, after we did that, he started to concentrate a lot better. He started to be more calmer. He started to sleep better. And then that basically was a source of inspiration for me to then start learning a lot more about how the face develops and the body develops and the brain and mind and all those things, and how that connects to breathing, lip posture, tongue posture, chewing. And well, I came across a lot of your stuff as well. So indirectly, Mike, you've been a big inspiration for myself early on, without even realizing, you and your father especially. And I ended up getting the book, the Bioblock by your dad, and reading that as well. So that's how I started into that field.
Yeah. No, I think my father's inspired a lot of people, and he wasn't the first in this area. I think he clarified it best, and he came up with the only sensible well, is the only sensible treatment option? Yes, it's a sensible treatment option, but it's a very hard thing to do. And of course, as I've learnt, it's getting people as young as possible, because once they've grown, it's hard to change. If you get them young and, you're talking about your child there at 3 years old, but also it's about trying to remind them to change, because anyone can stand up correctly and have good posture, follow the tropic premise, but almost no one does it all the time. And one of the things I think we're missing is these reminders to do it. And that's why I was particularly interested in your myospots. Can you tell me a little bit? Can you take that conversation forward a little bit there?
Well, so what happened with me? I started to study oral myofunctional therapy, and I began learning various techniques on how the face should posture and function. I became fascinated and almost obsessed on how does it all work, and why is it that some people have got amazing developed faces, and what is it that's in common with those faces compared to those faces that are not so well developed. And it doesn't take a genius to see where if you see like cartoon or characters of when they want to make someone look not so competent, they'll have them with their mouth open, with their head forward, sometimes their tongue poking out of their mouths, and they do it with animals as well. Sometimes you see a camel with their tongue hanging out the side of but if they want somebody that is competent and confident, they'll have their lips together and they'll be breathing through their nose, and I can almost certainly bet that their tongue is positioned up against their palate as well. So I became fascinated with how that all works. And
well, it's interesting how when you're looking at the Disney cartoons and cartoons done, these guys have not been taught this. Yeah. They've learned this intuitively. They know that someone like this is looking intelligent and someone like this is looking dumb.
Yeah. And I talk to a lot of patients about this, and I write a lot about this as well, that aesthetics and health are very, very closely related. When somebody is good looking, they tend to be healthy, and that's because we are attracted to healthy people, because it might be because they make better partners, and it might be because we, without realizing it, we want our offspring to be healthy and to survive, and all those things
yeah. So my phrase on this is, your face is the CV of your health.
Yeah, absolutely.
And we're hardwired to be attractive to people who have attained good health. I mean, we know we're attracted to people who are symmetric, but I think it goes way beyond.
Yeah, it does. And I mean, when your face looks good and you are functioning healthily, you sleep better, you can concentrate better, you're more productive, you can work better, you're physically able to perform better. And all those things are interconnected in a way that is almost seeded in our DNA, and we can't. And that's why those Disney sort of cartoonists, they do it without realizing. They know that that's a healthy thing to do, and this is an unhealthy thing. Nobody told them, like what you said. And so I became fascinated with that, and I wanted to understand how things work. And there was like a number of cases that were sort of quite revolutionary to me, and I saw them change. And I'm happy to put some of those photos up for yourself so you can show your audience. But I had a couple of cases where we treat, and within 3 months, sometimes even less, we'd have anterior open bites. That's where your front teeth don't touch exactly, and the maxilla, which is that top bone, is quite narrow. And within a few months, yes, often, yeah. And then within a few months of just teaching them where to position their tongue, how to keep their, the lips together, get them to breathe through their nose, get them to chew hard foods, within a few months, you see dramatic changes, and you're like, what is going on here? And so I really wanted to be able to create some kind of unconscious reminder so that the tongue knows where to be. Because I figured that, well, and it's not me that figured this, actually. Everybody who's in this field knows it. It's that if the tongue is up against the palate and it's correctly positioned, then it's almost impossible to breathe through your mouth. So
Yes.
you're forced to breathe through your nose. And so what happens is that the tongue elevates, it brings the lower jaw up, your hyoid comes up, and your lips come together. And you have to breathe. And the only way to breathe is through your nose. So the tongue to me became like a very important centerpiece. And that's where the idea of coming up with something like the Myospot, the small dissolvable spots, and again, I can send you like an image that you can show your audience, and that just sticks up to the roof of the mouth, and the tongue just touches it and slowly dissolves over a period of 45 minutes to an hour. And in that time, you don't even realize it, but your tongue is elevating unconsciously. And that was the whole idea behind it. And I know there's a lot more factors to getting like perfectly developed, well-developed faces, but the tongue is one of the central pieces. Obviously, like there's things like chewing and learning how to swallow correctly. But if we get the tongue in the right position, then that's, it's like the low-hanging fruit. Get that sorted.
Yes.
Get the tongue
Yeah.
in
But
the right place.
this is, as my father describes, as the tropic premise. And clearly what's then become mewing. It's this whole idea that you can influence the growth of the craniofacial structure. And these are the rules by which that influence occurs.
Absolutely. And I know there's a massive debate out there as to what it is that causes your face to develop in certain ways. And it's absolutely no surprise to me at all that muscular movements influence the way your face develops.
Yeah. Well, people have no problem with believing that muscle usage influences how your physical body grows. No one's going to deny that if I go down the gym, I eat a lot of protein and I work really hard, I could build my body up. Maybe at my age, I couldn't build it up to being as fantastic as I could when I was in my 30s. However, no one's going to debate that it's a possibility. To suggest that you can change facial form by building your muscles up or putting your tongue on the roof of your mouth still seems a little bit confrontational or alien to people. And yet, I say, look at an image of someone who has a stroke. Someone has a stroke, one side of their face drops down. So logically, it would make absolute sense that the posture and function of your facial musculature is going to have an influence on the structure itself. And, unfortunately, the tide of medical and public opinion believes it's genetic.
Yeah.
And that's something that we've got to come across. I mean, one of the things I wanted to talk to you about was what your thoughts were on why teeth were crooked.
Well, yeah, let me start with a story early on of a patient I had before I actually got into this whole field. A few years out of university, I had a patient, and I won't say her full name, but her first name was Alana. And Alana was a model, a very attractive young lady, and she had really well-formed jawline, nice cheekbones, a nice wide maxilla. And I'd spoken to her because she was about to go overseas because she had a modeling contract. Said goodbye and saw her about, I think it might have been 3 years later. And when she came in, there was a difference in the size of maxilla that was visible, and I could see it, but there was, unfortunately I didn't take any measurements, but this is my experience. And I started probing it. I'm like, so how was your experience when you went overseas? I can't remember which European country she went to. And she said, look, it was really good. I said, well, was there anything that was different, that you did different? And then she opened up to me. She said, look, I got into drugs. and she became a drug addict for a period of time. And during that period, I could imagine what would happen to her asleep. This came to me later on. I was wondering why her maxilla started to sort of change and shape. And it wasn't just, it was her cheekbones as well. And she started to sort of like underneath, it wasn't as pronounced in this area over here. And this was a period of 3 years. And she started mouth breathing when she was asleep. She became a chronic mouth breather. And I saw that. And I wish I had taken photos. But then I realized, well, environment.
So she gained a chronic obstructive nose. A nose will become chronically obstructed from taking drugs.
Yeah, I would say it's either that, or when they go to sleep, I think they start to lose, some kind of ability to breathe the way they normally do, because the drugs sort of put your body to sleep in a way, in a sleep that's unnatural. So you kind of just pass out with your mouth open. Maybe, I don't know. I don't know if she ended up with an obstruction in her nose, but I know that something changed, and I assumed that the heavy drug, because if you ever see anybody who's on drugs, they don't look quite right, and they end up starting to breathe a little bit different as well. A lot of them become mouth breathers. So it was my first experience into what was something that was an environmental change.
So there's been an environmental influence on this girl, and what did you think it had done to her face?
Well, certainly the width of her maxilla was nowhere near what it was when I first saw her, and I could see that her face became a little bit narrower, and her jaw started to come down a bit.
So she downswung, as I say.
Yes, a bit like the elephant trunk.
Yeah,
a bit like your dad speaks about.
What time period was this?
It was roughly 3 years. 3 years. So it was a big period of time, but enough to. And I mean, she was in her 20s. So, and I'd seen that change. So she wasn't really in her growing phase, but so I'd seen that, and that was an experience that I thought, well, there's something going on here. The other thing, now I've got a score of patients, and I'm happy to share some of the images with you. But a score of patients where they'll come in. The average child that will come in will be chronic mouth breathers, crooked teeth. They'll be struggling to breathe through their nose. They can't chew hard foods for very long because they don't have the masticatory power to do it for long, the endurance. And within 6 to 12 months, their faces are completely different. And I know for a fact, if we didn't intervene, they'd be just the same, but a little bit bigger. And so I see those things a lot. So as to whether it's genetic or environment or epigenetic, genetics is very important, because you are what you are with genetics. But we're starting to realize more and more, there used to be this debate as to what is junk DNA. And people used to say, well, it's just junk, it's leftover stuff. And then later on, they found out that, well, this thing they call junk DNA is actually bits of information that regulates the DNA and is influenced by the environment to change things. And if you look at the Eskimos, the Eskimos, they say with the Eskimos, their arms are a bit shorter. And the reason it's a bit shorter is because when you're living in these cold environments, you want to keep the warmth in. Now you take an Eskimo and you put him in a warm environment, his second or third generation are going to have longer arms. And that's because the epigenetic factors are causing, allowing that genetics to materialize in various environments. And so just like there is an epigenetic influence in the Eskimos and other animals as well, you put them in different environments, different kind of, developments in their body occur. So I believe that crooked teeth is one of those things as well. And I know that's a controversial thing out there. Yes, there is a genetic component, but definitely there is an environmental component as well. Because
I think in this, we need to look at this area. You know, I've been running a campaign to have a debate on why are teeth crooked. I think how would I say? I think it's somewhat negligent that my profession openly admits that it doesn't know the cause of crooked teeth and is not trying to engage in debate at every opportunity. I think that's remiss of my profession. But, you know, you've come up with some suggestions, some ideas of very basically putting forward a epigenetic hypothesis or a mixed hypothesis. Well, you've got to remember that the orthodontic community openly admits it doesn't know. So when you've got a blank, well, I'm welcoming all ideas, you know, throw them out there. Let's set them all up and have a full, free and fair engagement where we have meaningful discussion and come to some conclusions, because, you know, your idea could be in there with a shout.
Do you remember that study they did on chimps where they blocked their noses?
Yes, this was Harvold and Vardovic.
Yeah, and then they'd seen facial changes in the chimps.
Yes. Yeah, I mean, the criticism of that from the orthodontic community is that that's a very unlikely scenario, total nasal obstruction. We do see it. In fact, there's a great image in this book here of a boy who gained total nasal obstruction, and he follows a very similar pattern to Harvold's monkeys. The research of Harvold's that I actually think was better was where he simply placed an uncomfortable plastic wedge on the roof of the monkeys. It was an earlier paper, but it was more controlled. And they had, if I remember correctly, they had 6 experimental growing males, 6 experimental growing females, 6 experimental non-growing females, and then age and sex matched controls. So 18 monkeys in each group. And they saw, as you put this uncomfortable wedge of plastic on the roof of the mouth, the monkeys couldn't put their tongue up there. And because the monkeys couldn't put the tongue up there, the tongue had to drop down because it was uncomfortable, ulcerated. So they did nothing more than changing the position, the resting position of the tongue. And you didn't need statistics because you've got 18 control monkeys, all with near perfect facial development and growth, and 18 experimental monkeys, every single one of them with a gross dental and skeletal malocclusion. And the fact that the maxilla dropped, what was it, by 1.4 millimeters per month in all 3 groups. So the growing ones, male and female, but also the non-growing females, which goes back to the girl you mentioned who had been a model. That it seems that when, you know, it's very difficult to get the face to grow well. I know, I've been trying so hard. But when it goes wrong, it seems to go wrong really quite rapidly and dramatically.
I see exactly what you're saying, but I don't find it difficult to understand the concept of bones being in a balance between muscles. And the reason I say that is like, we can look at the other side of the body. If you look at feet, for instance, you know, that there's another problem happening right now with and toes that are sort of, you know, squished in and smaller feet. And if you look at a lot of the shoes, well, the stilettos or whatever it is that's sort of squeezing the toes together and really high heel to shorten the calf muscles, that has follow-on effects to the rest of the body. The feet getting smaller, the bones are sort of pointing out left and right. Now, in the practice I work at, Gold Coast Holistic Practice, the children that I see with the nicest feet, and the reason I say I don't go looking at their feet, but often they come in barefoot. the ones with the nice feet. So their toes are nice and spread. There are no bunions there. And I asked the parents, what's going on with your child? And we just let them run around barefoot. And I'm not advocating that. Please don't misunderstand me. I'm not advocating to walk around barefoot, but it seems to me that when the feet are allowed to, I know we're talking about the other side of the body, that they start developing well. Now, the children with the well-developed faces, the ones that do come to me with well-developed faces, I can tell you the vast majority, and with a very few exceptions, like for instance, like sometimes you see the ones with really strong jaw, the class 3, but they still look kind of okay, but they're not quite right there because the maxilla hasn't developed a top bone when the jaw, the lower is overdeveloping. But the ones who are developing really well, they got the lips together, they're breathing through their nose, and when I ask them where their tongue is, the vast majority tell me that their tongue is up against the roof of the mouth. And some of them say, well, where should it be? Shouldn't it always be there? So it seems to me, just from looking at what I see, that the ones who are developing well have this posture where their tongue is elevated, lips together, breathing through the nose. And a lot of them are really capable of chewing for long periods of time, hard foods. Now, the ones that are not developed well, often they can't chew for very long. They often breathe through their mouths, but on and off. Sometimes they'll have their lips together, but then when their lips are together, because they're doing a lot of mouth breathing from time to time, their tongue is low because it's habitually low. So they'll breathe through their nose for a little bit, but their tongue is still low while their lips are together. So they've lost that habitual tongue elevation posture. So for me, it's not a big, it's not unbelievable for me to understand that this is how the face should be, and that's how it develops. It's from what I observe, and I'm sure that everybody observes it if they start looking for it. I mean, if anybody's out there, you can just go and have a look at your children's friends. Have a look at the ones that are looking well developed, and I can tell you the majority of them are going to have their lips together, breathing through the nose. But the ones
stand up straight with the mouth shut.
That's exactly right. So it's not such a big. And the other thing I wanted to mention is the teeth. They tend to be in this very balanced position between the cheeks and the tongue. And so if for some reason you've got muscles that are not well balanced around your lips and cheeks, then they will be hyperactive and they'll be pushing against your teeth and bringing your teeth in to make them not where they should be, and they can get sort of tight.
You're upsetting the balance.
Exactly right. And so what tends to happen, this is what I find, the swallow is a very interesting thing. So if the tongue is not elevated against the roof of the mouth, that you often find that this muscle here is hyperactive, the mentalis, and sometimes your lips, your buccalosaurus and your bucks, they tend to be a bit hyperactive during the swallow. And the way I rationalize that is that I feel as though because their tongue can't hold food or bolus or against the roof of the mouth and have that natural swallow, then they're worried that they're going to dribble. Now, this is not a conscious, this is a subconscious thing. They're worried that they're going to lose food or fluid out the sides of their mouths. So this muscle starts to tense up to hold it. And I've observed
overcompensating.
Exactly.
Yeah.
And I've observed it when I get somebody in the clinic to swallow some water, for instance, you see that they pull their chin up and they're doing this kind of thing. And I'm like, why are you doing that? And because if they don't do that, then the liquid, or it's usually water that I get them to swallow, they'll start dribbling down the sides of their mouths. So I teach them how to swallow with their tongue to the point where they'll put a little bit of fluid in their water in their mouth, and I'll get them to open their mouth and swallow. And if they can get past that, then I'll get them to actually put their head over the sink and open their mouth and swallow. And once they can do that, if nothing falls out, they don't need those muscles anymore. And they start to learn how to swallow correctly.
So
those muscles.
Yeah. So what we're saying here is if the tongue's up on the roof of the mouth, it's making a seal on the palate, then you actually don't need the lips to be together.
Exactly.
It's when the tongue's not fully on the roof of the mouth, then you're going to need to hold the lips together. And you see action in the lips when you swallow, parents watching this. If your child has any, what we refer to as perioral, around the mouth, activity on swallowing, it's a bad sign.
It's a bad sign. Now, the other point that's really important is that imagine how many times you swallow a day. I don't know what that number is, but it's
the people estimate between 500 and 2,000.
Right. So that's a big number. Now imagine doing that. Imagine 1,000 times swallowing that way. Now I suspect the ones with dysfunctional swallowing are doing it more because it's like an unconscious sort of, I'm worried that I'm going to dribble some of my saliva down here, so I'm going to do it. Maybe not. But even if it is 1,000, imagine doing that 1,000 times, getting that muscle activity up against your jaw, pushing in. Which direction do you think your teeth are going to go? Are they going to go out towards the lips, or are they going to go in towards the tongue? And crooked teeth is usually something where teeth are moving in towards the tongue and not the other way around.
No, it's generally crowding. And when I see spacing, I'm often thinking the spacing isn't because the tongue has kicked everything out. It's because the tongue has stopped everything moving round and forwards.
Exactly.
So, yes, basically, what you're saying is that if you suck your teeth in every swallow 1,000 times a day, you're likely to pull them in.
Absolutely, 100%. I mean, how do braces work? They apply a force in the opposite direction. Or Invisalign, they apply force in the opposite direction.
If we were to make a ballpark evaluation where, with the teeth sit in a balance between the tongue on the inside and the lips and the cheeks on the outside, it would appear that the tongue has lost.
100%.
Most teeth are set in and crowded. So there we go. On a global scale, tongues are losing out. So we need to get the tongue to be stronger, more active, and to do its function correctly. And from everything we know, we think the tongue should be up on the roof of the mouth, ceiling on the roof of the mouth. And that's coming back to these myospots. So, I remember being taught, who was it? It was Sandra Coulson came over. I organized Sandra Coulson to come over and give a lecture in the UK. That must be something like 12 years ago now. Oh. And it was great. She came over, she did the lecture, and she was talking about getting some strips of methyl cellulose. So we got strips of methyl cellulose. This was a product that had been developed for people who had stomas. So if you needed to, around a stoma, so if you understand what a stoma is, it's where your intestines have been brought to the surface of your skin, and basically you're going to poo in a bag, and you need that bag to stick to the skin. So they developed this material, methyl cellulose, so that you could stick these bags to the skin, and it had to be something that stuck to skin really nicely. It had to be completely biodegradable, because if your stoma isn't going to move, so you're going to need to stick to the same skin every day, day in, day out, because you need this bag there all the time. And they were using this stuff, methyl cellulose. You get it in strips, and we would cut it into little triangles. Or actually, I remember Sandra Khan giving us a, have I got one on the table? A hole punch.
Like a hole puncher, yeah.
Yeah, so we get a hole punch, and we'd go, you'd sit and go bang, 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 bang on these bits of methyl cellulose. You'd peel the bits of methyl cellulose, and you'd stick it up on the what we call the end spot, because it's what we go no. So the famous end spot, or the spot, or I've got so many names for this point, is usually the incisive foramen, actually, or incisive papilla. And then I saw your tubs, in fact I've got one here. There we go. Your myospot tubs. We should use that more, but of course it's always difficult in a clinic where we're got so many different ideas and things running at the same time. So your myospots were effectively a product to do exactly what we'd been trying to do with these hole punchers and strips of methyl cellulose.
Interesting story. I did try to start using those at one point in time, and that was actually part of the inspiration of making Myospots. What happened is that when I started using them, the first thing I did, now I work at a practice where you can guarantee that all my patients are going to do research on every single thing that I use. They will know more about the composite than a lot of dentists will. And they'll come back and they say, well, this is all the ingredients. So I had to look up and find, I actually ended up emailing the Stomaadhesive guys and saying, well, what's the ingredients? And there were a few ingredients that I didn't agree with. One of them was, it was porcine. And that meant that it was, pig meat. And so me being me, I know that that excludes Jews and Muslims because they don't eat pork. And of course, it excludes the vegans and vegetarians. So that was the first thing. And the other thing is that it wasn't intended for oral use. And when I asked them,
yes, well, there was always that.
so obviously insurances and things like that. And so that was one of, but yes, it is. The idea was fantastic because
when I saw your idea, when I first saw Myospots, I came straight through to contact you, and we got some samples. I just thought, this is something I've thought of doing. I mean, you need to be, if you've got a brain on you and you want to move forward, you're thinking, I need a product. I don't just need to be sitting here with this hole puncher. That's not the right idea.
And the great thing is, because me and obviously my colleague Ibrahim, when we put this together, well, my patients were my guinea pigs to begin with, and so I got the privilege of being able to use them for quite some time on patients to see how it worked, and that was really fun. And at this stage, we're doing as I mentioned, I think before we started, we're doing some research and getting some amazing results with you wouldn't believe it, like with sleep apnea. We're getting some amazing results with sleep apnea where severe sleep apneics are now able to look. One patient, and we got his video on YouTube actually, Lawrence. He wasn't able to sleep next to his wife.
We'll see if we can put that link below.
Yeah, okay, that'd be and so he wasn't able to sleep next to his wife. Loud he would snore. He was so tired that he needed 1 to 2 hour naps during the day. And he's an older guy, he's mid-60s. And so when I explained to him how it worked, he was very skeptical. But now he's able to sleep next to his wife and he doesn't get tired. And his story is amazing because he didn't that you needed to keep your tongue up against the roof of your mouth. And he didn't know that it was a healthier thing to breathe through your nose. And it's something that you and I find, it's obvious to us because, this is what we do. But when others find out, okay, this is what you need to do, it's a surprise to them. And so now we're getting some actual studies done with Griffith University on the Gold Coast, and the results are coming out and it's looking really positive. The other thing that's really amazing is the anterior open bite for children, just getting that tongue up there. Yeah. And I'll actually, I'll send you, as I said, a couple of cases. I'll send you a couple of cases you can put up there. Within 3 months, Mike, got like 3.5 millimeters, virtually down to zero opening. And another case that we did, and this is no expansion, just purely getting the tongue up and teaching him how to swallow and chew and things. One of them was actually pure Myospots. The complete closure of the anterior open and a visible widening of the maxilla within this particular case, 3 to 6 months. Amazing. So it
what age
goes
group was
to
that?
show you that. So the first one was the first one I mentioned was about 3 years old, and the second one was 10 years old. So amazing that what you can get in such a short period of time. And I really like this. I'll paraphrase what Hippocrates said, like in terms of what a doctor should do. We should basically show them the way and get out of the way.
Show them the way and get out of the way.
Yeah, that's right. Like it's paraphrasing, but the way I see it is the body has an amazing ability to heal. and it's got an amazing ability to want to develop the way it should. And human beings by nature, all human beings by nature are good-looking creatures. And it's not until we get in there and put the wrong environment that our faces start developing not the way they should.
So we should all be reclaiming good health and aesthetic appearance.
Absolutely. And health is the prelude to aesthetics. You get the health right, do the healthy things right, and all of a sudden it's just a bonus. It's like the icing on the cake.
All comes together. Well, I never forget going to a party and a couple of people saying, "Oh, Mike, you're looking healthy," and I'm thinking, "You mean I'm looking good?" Because it's the same thing, really.
Yeah, absolutely. Yeah. So look, Mike, I think that there's a lot happening out there in terms of shifting the way we think, whether it be medicine.
I think there is a huge, as we were talking briefly about before we started the video, there's a huge groundswell, and I'm partly to attribute this, but I think I'm not the only one. There's many other people. You know, as Victor Hugo said, nothing can stop an idea whose time has come. And my father was just too far ahead of his time.
Yeah, Mike, look, I think we're at a time where in the future, we're going to look back at these times and think to ourselves, well, what you and your father have done, what you've brought to the world, and obviously the hardships you're going through and the hardships your father's gone through, and a lot of practitioners that are probably, unnamed, they'll be looking back and saying, well, you know what, how silly of us to overlook something that was so obvious. And what's interesting, Mike, what's really interesting is that the ones who oppose it most seem to be the ones from the orthodontic dental industry. But if you speak to a doctor, like my brother's a doctor, and I've got a lot of like medical practitioner friends, and you explain to them how, face development, what you think might be causing crooked teeth and that, and it's very obvious. And they're like, yeah, we totally understand sense, because that's how the rest of the body works. It doesn't make sense that one part of the body doesn't work the same as the rest. So I do feel that things will move along, and the way we see the etiology or the cause of crooked teeth as just being in this small little shady box of genetics will become a lot more open-minded and realize, well, you know what? It's not quite just that. There's a lot more to it.
Yeah.
That's where the environment comes in.
It continues to amaze me. I feel that anyone whose mind has not already been polarized, or you don't already have an existing idea, this is obvious.
Yeah.
But whenever I talk to a dentist or an orthodontist, literally, I could be talking to a brick wall. It's like you make these propositions, and it's like they're mentally fighting it every step of the way, and it's just teeth in a hen sort of. It's difficult, and it's once you believe something, once you've got one idea in your head, it's so difficult to get out of that concept and really look at things in an unbiased manner.
Look, Mark, I do want to mention one thing. Recently, I went back to university to study statistics, just because I just did a subject on just to understand how research works. And I had access to the local university database, and I can tell you, my God, the number of papers, and when we're talking about, systematic reviews, meta-analyses, and I can actually send some to you if you want to actually share with your viewers on the connection to things like tongue posture, to nasal breathing, how that is connected to your neck, for instance, or to
it was so Benny Solo as well.
And also to your teeth. There's a number of papers out there that show.
I mean, the evidence, it's not a shortage of evidence. It's it's is making common sense of this.
Yeah.
Putting it together.
Absolutely.
And actually, it's a debate. What we're missing is not evidence, it's debate.
Yeah. Yeah, well,
Yes,
that's right.
it's meaningful debate. That's what we're missing. Full, free, and fair debate. I've been calling for debate on what causes crooked teeth. I think we should start there and work up. Start with the cause and work up. That was one of my missions. I started in that 2009.
Yeah, that'd be.
And funnily enough, had that occurred, I wouldn't be having a court case against me.
Yeah, yeah. I would love to see such a debate. I'd love to be, involved in such a debate if I had the privilege to. If not, just to see and I would be surprised that there is any serious kind of evidence to suggest that environment has zero impact. I would be very, very surprised that there is any kind of serious evidence.
Well, the thing is, we need to be rounding up, but I don't think that's denied by the orthodontic profession. It's just ignored. So you go through, let's say, one of the main textbooks, well, I've got Profit Contemporary Orthodontics just over here, and they go through lots of environmental influences, but all of the treatment is there's nothing done to affect that in those environmental issues. The treatment is aimed to make a teeth straight.
Yeah.
Okay.
And, just before I finish, there's one thing that I do want your viewers to understand. And every patient that comes into me and says, "Oh, are you going to make my teeth crooked?" and straight because they're crooked, and I'll tell them that, look, what I want to do is give you a straight face, and generally speaking, your teeth actually end up quite straight in that face. But what I don't want to do is give you straight teeth in a crooked face, because that can cause issues later on. Yeah, if I could leave you viewers with that, because that's
No, I think that's a very good phrase.
a really important point.
And I always say to people who come in to see me, I say, well, listen, if you've got to decide what you want. In this clinic here, I'm focused on the face, and the teeth come second.
Yes, perfect.
All right, listen. So we're just going to we're going to give you another plug for your thing, Myospots. I'd highly recommend them. Anyone try them. It's one thing, one day isn't going to do anything. It's something you've got to create a habit. And the Myospots are going to sit up on your incisive papilla. They're going to dissolve progressively. You've got these in several flavors. This flavor is the blueberry flavor. I can't say I thought they were that blueberryish, but definitely they've got some form of flavor. You stick them there, and then within an hour or so, they dissolve, and you work your tongue on them, and that's making you get your tongue on the roof of the mouth. It's acting as a reminder. These are the prompts and the props that we have so that we can gain change, so that we can reclaim good health, and of course, with that, reclaim good looks. Cheer. Pleasure to interview you, Les, and I would love to come down and meet you on the Gold Coast.
Let's do it one day, or I'll come down to the UK. Thank you very
Cool.
much.
Thank you very much indeed. All right, take care.